My name is Peggy Brodowski. I am Director of Nursing for the Department of Health and Human Services here at the Township of Montclair. And I'm here today to talk about the coronavirus, the novel coronavirus, also referred to as COVID-19. What is a coronavirus? Coronaviruses are common viruses in people and many different species of animals. They circulate seasonally every year, pretty much in the fall and winter, and they do cause respiratory illness. What we need to know is that they spread pretty much like colds and flu. This virus, again, is new. It began infecting humans in Wuhan, China in December of 2019. And at this time, there is no immunity. I will reassure you that the Centers for Disease Control and New Jersey Department of Health are watching this virus very closely, gathering data and doing what they need to do on their end to help control the spread. A lot of people are wondering about their risk. This is, again, a rapidly evolving situation, so the risk assessment may change daily. You may be wondering, am I at risk? Again, to date, the current risk to the general public in the United States is considered low. So putting your risk into perspective, it's very, very important that we think about flu. Currently, right now in New Jersey, flu is actually widespread. We are seeing a lot of flu in New Jersey. Now, in terms of flu also causes millions of cases of illness each year in the United States. In 2017 and 18, an estimated number of deaths from flu were between 12,000 and 61,000. Flu severity is also unpredictable. Healthy people can become seriously ill from the flu. However, in general, flu causes low level of concern because it's familiar and it's almost an expected part of life every year. It's important to remember the things that you should be doing. If you haven't had a flu shot, you should seek a flu shot. Talk to your doctor. Again, when we look at the numbers that are related to flu in terms of hospitalizations, illnesses, 45 million people, those numbers are very, very high. So you can kind of put that into perspective when you look at the numbers that we're dealing with the coronavirus right now. Signs and symptoms would be, again, for most people who become infected with the virus, they experience symptoms much like other respiratory illnesses. So we're talking about fever, cough, shortness of breath. Fever would be 100.4 or greater. Cough, shortness of breath. And these symptoms can essentially range from mild to severe. Deaths, mainly in older adults and those with other pre-existing health conditions, have been reported. At this time, there is no specific vaccine to prevent against novel coronavirus. In terms of treatment, other than easing the symptoms in those who have mild illness to make them more comfortable, in other words, decongestants or cough suppressants or fever-reducing medications, having those available. More serious cases of coronaviruses may require supportive care if the patient develops shortness of breath or they develop pneumonia. Coronavirus is spread from person to person, much like any other respiratory illness does. And you can see in this picture how that virus, when this person sneezes, sprays out. So it's spread through the air by coughs and sneezes, that's droplets. And it also can be from touching an object or a surface with the virus on it, and then going ahead and touching your eyes, nose, or mouth. Also, they are spread by close contact with those who are actually sick. Another way would be healthcare workers could be at risk, and many healthcare workers need to wear protective gear to prevent against exposure during any procedures that they have when they're taking care of someone ill with the coronavirus. The person becomes sick anywhere from 2 to 14 days after coming in contact with the virus. For COVID-19, that incubation period is about 2 to 14 days. There are some reports that the disease may spread before a person has symptoms, but this is not the main way that the virus spreads. As with any new virus, there is still much the CDC is diligently looking at and collecting information and analyzing information on so that they can give the proper guidelines and recommendations to our communities. As with other respiratory illnesses, the same prevention strategies apply. Cover coughs and sneezes with your tissue or sleeve, not your hands. Why not your hands? Because you think about it, if you sneeze into your hand, you've just sneezed perhaps the virus into your hands, and then you're going to go ahead and touch in the area or a person, and then we're just kind of moving that virus all over the place. So we want to wash our hands often, and by that, wash and at least for 20 seconds, not too, count it out. Give it 20 seconds. Get a little friction going. Get the soap in there. If you don't have soap or water, having a hand sanitizer is very helpful if it's not available. We want to stay home when we're sick. That's really, really the most important thing to do. And avoid others, obviously, who are sick. That one picture of the woman sneezing is a really good one, or coughing. So that's what we call respiratory etiquette. And by that picture, you can see you're actually coughing and sneezing into your elbow. In other words, you're covering your nose and you're covering your mouth completely. Because if you just cough into the general direction of your elbow, that droplet is pretty much also going out into the environment. So that's important. If you can't sneeze into your elbow, having tissues readily available and doing that, and then properly disposing them is very, very important. And hand washing, hand washing, hand washing. We can't emphasize that enough. Should I wear a mask? At this present time, the CDC does not recommend the routine use of face masks by the general public, and that's really important to remind you of. What is the New Jersey Department of Health doing to prepare? Working very closely with the CDC and the local public health partners, establishing clinical guidance documents in the event New Jersey does have a case, and establishing communication with healthcare providers and public health officials statewide. Please remember, this is very important, for more information, please remember that there's a lot of misinformation out there, and news media can sometimes get the facts wrong, and sometimes even maybe sensationalize the information, so you really want to go to credible sources. So the New Jersey Department of Health website is right here. You can see the link, as well as their social media. You can keep updated that way as well, Twitter, Instagram, and Facebook. And the CDC website is listed there as well. All of these are updated. The New Jersey Department of Health is working in conjunction with the New Jersey Poison Control Center to operate a call center. And that number is 1-800-222-1222. And if you have questions after looking at the CDC website or New Jersey Department of Health website or listening to this program, you can go ahead and call. The hours are 24/7. A trained healthcare professional will answer your question, and it's available in multiple languages as well. So it's a wonderful resource for us. And remember, it is still flu season, so we have that going on as well. So again, did you have a flu shot? Looking at your own home in terms of, are you prepared if you did get ill? So in other words, do you have thermometers, working thermometers, fever-reducing medications available, cough medications as appropriately ordered by your doctor, having your tissues and things like that, having enough food and water if need be, if you do become ill. For older seniors or older population, we want to make sure that you have your medical history written up and readily available, so that if you did need to go to the doctor, you already have it there with who your primary doctor is, your cardiologist, your pulmonologist, whatever current prescriptions you're on. You want to make sure you have an ample supply of them, but again, you want to have that list on you, so if you did have to go to the doctor or the urgent care, you have that handy. Other things that you need to have in your home are your household supplies, because you want to keep everybody healthy in the house, so you want to make sure that you have your proper cleaning supplies. As well as, if you have any young children or babies or even pets, making sure you have an ample supply for them as well. Right now, the New Jersey Department of Health does have guidance out there for businesses and schools and universities, so there's a lot of good information there on the website as well. I want to rest assure you that the Montclair Health Department, in conjunction with the County Health Department, State Health Department, Offices of Emergency Management, first responders. We're all looking at our preparedness plans and doing what we need to do on our end to help control any spread in the community. And we will update you and update the website accordingly. I thank you for your time and attention. Be well.